Good morning. So nice to see you. Hope your day is off to a great start. This is kind of a battery season of the year with the holidays. All of us are rushing out to the store to get those last-minute batteries. Dr. Tiffany Ahlberg is here with Ahlberg Audiology, and batteries are her topic. When you first told me, I thought that's kind of what you were going to reference, was the holiday season and the need to get those batteries. But no, this is a whole different topic.
Well, people are buying batteries for their loved ones for Christmas. We've had a lot of people come in and for stocking stuffers and things. But one of the things that people have been asking me a lot lately, and it's and I don't think that it is well known, is that the battery packaging has changed drastically. And it's really gone into effect this year. It was something signed by the president in 2022 called Reese's Law, where any battery that could be swallowed by a child is now required to be in a child-proof packaging container.
So what does that look like, a child-proof packaging container?
So in the hearing aid world, it is, the batteries are literally like sealed together. And so it used to be that you could flip open, you would have a dial, you'd flip open the battery package and you could take the battery out. Well, now that requires that you use pretty heavy duty scissors to cut the batteries out of the packaging. Now, one thing to keep in, so what some of my people that maybe have dexterity issues and they can't cut real well, they're having to get family members to cut these batteries out of the packaging. And then I've had a few people come in and they've had them in pill containers, which defeats the point of this law was passed so that people would not swallow batteries. So now they're putting them in pill containers because hearing aid batteries are zinc air batteries. They're not your traditional alkaline batteries. They can't touch. If they touch each other, they die. So these batteries can't just be emptied out of the containers and then put into a little, you know, maybe a Ziploc bag together, right? Because they are going to die.
So sorry, but this is all new to me. So we can all picture the pillbox container that has your 7 days of the week or whatever it is. So in the packaging, it's one battery per sealed thing. So are people taking out and putting one in each pillbox? Okay, so is your concern that it's defeating the purpose of the law, or is your concern that in doing that they're damaging their battery?
Oh, it's definitely that it's dangerous because I'm afraid somebody's going to think it's a pill and then they're going to swallow it.
Oh, I see. Okay.
Yeah. And so it makes sense. It's a brilliant idea to keep them separated and have somebody else cut them out of the packaging, but it's totally defeating what this law was created for in the hearing aid world.
So what are you supposed to do?
I know people ask me that, and so it is something that was, you know, it's a government. It's not the battery. It's not Duracell. It's not Rayovac. It's not their fault. It was a federal law that was signed into effect in 2022 by the president, and there's nothing you can do except for maybe appeal to senators and congressmen and say, hey, maybe there's a better solution to this, that they're in different packaging. I know, it's really sad.
What is the lifespan of those batteries? Like how frequently are people having to replace them?
Anywhere from 2 days to 2 weeks.
What?
Yes.
What an inconvenience for people.
Yes, yes.
2 days to 2 weeks.
Yeah.
So could you, I mean, I kind of understand the devil's advocate side of things, though. I appreciate what you're saying about if it's, you don't want to have it defeat the purpose of the bill. But if you live alone and you have no small children coming around and you know that what you're putting in the pillbox are your hearing aid batteries, that's, I mean, what are you going to do?
Yeah. I mean, do it. I just, it worries me. And I just wanted.
That's fair. Well, I didn't, but also I can see as you get older too, you might not remember. That happens with my mom. What's in that pillbox? So even if you put it in like an individual container that wasn't a pillbox, I guess your concern is though.
Well, and I have had people twice in my career that have accidentally put their battery with their hand of pills and just threw it in their mouth and swallowed it. So it's just.
Okay, so back, you mentioned people are coming in to get these for stocking stuffers and stuff. So back to the scissors. If you're calling in, you know, your son to come over or daughter to come over and help you open it, what kind of scissors are they using?
Well, just something that's not,
a normal scissor.
It's not the kindergarten scissors, you know. You can't,
yeah.
It's not the elementary school scissors that'll cut these things. It's literally, it's taking, you know, like the heavy duty scissors to cut these out.
I can picture it because there have been times where I've tried to open medicines and you can't peel it back and you have to cut it and you just can't get that thing out of there. So I can kind of imagine what it must be like.
Yeah.
So when you said if you really want to, you could write to your local legislator but in Washington, D.C. It's not a state law, it's a federal law.
It is, but you know, whenever we have tried to pass things in audiology, it starts at a local level to get to a higher level. So you can literally just look up like your Tennessee congressman or senator and start there, and then sometimes they will help you to bring this further. And maybe if we can get enough people to do that, maybe we could say, we understand the childproof packaging, but maybe there's a better solution for people who aren't able to use scissors to get these out.
Protecting one, but maybe inconveniencing another. Yeah, I can see that would be a challenge. Okay, while I've got you though, this has been a time of year where families have been together. A lot of people might be noticing some changes with people they love. Any recommendations on how to broach that conversation if you're concerned about a hearing loss?
Well, so hearing is your relationship with others, and so I feel like it's something that you have to appeal to someone, but it has to be their idea. You can suggest it, but they have to want it. But anytime that you notice that a loved one is not understanding, withdrawing from situations, I think it is important to kind of bring that up so that they know that you notice and that you love them and that you want to be a part of their life.
I know that you have the 2 offices now in Cleveland and up in Athens as well. So in terms of getting in to see you, if people think, okay, it's time, is the month of January pretty slammed for you, or will you have some openings?
December is slammed. I haven't even made it as far as looking at January. I think January is probably going to be a little less hectic than December. But
the early bird gets the worm, so give them a call. Let me show you how you can get in touch with them at Ahlberg Audiology on Ocoee Street in Cleveland, Congress Parkway in Athens. The 2 different phone numbers are there. Online, it's ahlbergaudiology.com. And just deal with the hassle right now with those batteries. They're trying to keep everybody safe. Thank you.
Thank you.